Connected by purpose, driven by passion. This is Children's Healthcare Canada's Spark Live webinar series.
Children's Healthcare Canada would like to thank our Keystone funding partners for their ongoing contributions that support all of our programs and activities, including this Spark Live weekly webinar series. Spark Live is where we gather each week to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. There are two options to join in on the live conversation. Questions and comments for our panel or presenters can be typed into the question box, or comments that you want to share with the audience can be typed into the chat box and be visible to all of the attendees. For those of you on Twitter, tag @ChildHealthCan on any webinar-related tweets or use the hashtag SparkLive. And to keep up to date on all of Children's Healthcare Canada's webinars and other activities, be sure to sign up for our weekly Spark Bulletin by visiting our website at childhealthcan.ca.
Hello everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series. I'm Paula Robeson, your host for the next hour. Children's Healthcare Canada acknowledges that our offices, located in Ottawa, are on the unceded, unsurrendered territory of the Algonquin Anishinaabe people. We are grateful to have the opportunity to be and live in this territory. Today, we're delighted to bring you Conducting a Research Trial During a Pandemic, the New Normal, and we're grateful for the support of our partner, the ChildRight Network. As mentioned in the intro video, please type your questions into the question box at any time during the presentation. I'll prompt you via the chat as well, and I'll pose the questions to our panel at the end of the session. I'd like to introduce our first speaker today. Jan Willem Gorter is the Director of CanChild and Professor in the Department of Pediatrics and an Associate Member of the School of Rehabilitation Science at McMaster University. He's co-principal investigator of the ChildRight READYorNot Brain-Based Disabilities project. Jan Willem will introduce his fellow panelists, and it's my pleasure now to pass the mic to Jan Willem.
Thank you, Paula, for the introduction, and thank you for the opportunity to present our webinar on conducting a research trial during a pandemic, the new normal. Next slide, please. So our agenda for today has five components. First, I will set the stage a little bit about our project, and then we'll go into social media recruitment. We will present to you on our online training and support materials, as well as consent and Assent materials. And then we'll end with conducting study visits virtually. This is our lineup of speakers today, and we will do it in duos. We will co-present our presentation. Next to me is Donna Thompson. She is a parent partner on our project and a ChildRight committee member. Both Barb Kalupi and Natalie Meilberg are the trial coordinators. Sonia Strom is research coordinator on the project, and Alicia Villa Duvnesne-Lay is the project manager at Montreal. Linda Nguyen is a PhD candidate and graduate trainee for the ChildRight Network. And Claire Dole-McCourt is a patient partner and a National Youth Advisory Panel member of the ChildRight Network. Here you see our full team of the core team. The project is run by Dr. Ariana Morelli, co-PI at McGill University, and myself in collaboration with Adrian Kovac, Ronan Rosenblum, and Kusha Maria. Also listed here are the core staff members, young adult patient advisors, parent and family advisors. And the study is a multi-site study and includes sites from the Alberta, Ontario, Quebec, and Maritime regions. The project is funded by the ChildRight Network under the Canadian Institute of Health Research CHR strategy for patient-oriented research, the SPORE strategy, with additional funding from our partner organizations. So let's set the stage. Our project is a transition project. So we'll talk about healthcare transition. We know that youth with brain-based disabilities, or BBD, require seamless transition from getting pediatric services, for example, at the children's treatment centers or children's hospitals, to looking after their own health in adult services. In many pediatric centers, however, there are no dedicated resources for transition of care. Future transition research should focus on youth-facing interventions, self-management, and technology innovations. To help youth with brain-based disabilities and families take charge of this transition, we have developed and we are now ready to evaluate an e-health application, the MyREADY Transition BBD app. This app was co-created by researchers, healthcare professionals, or HCPs, technology designers, youth and families, all working together. We developed the app with a focus on education, empowerment, and navigation as the core elements of healthcare transition planning. And by using the app, youth learn information and develop skills for self-management of their conditions and prepare for the event of the transfer from pediatric to adult care. The first phase of the project began in 2017 with the development and user testing of the MyREADY Transition BBD app. And now we are in the second phase where the app intervention will be deployed over the next few years across recruitment sites in Alberta, Ontario, Quebec, and the Maritimes in a randomized controlled trial or RCT. With this project, we would like to find out if there is a benefit to using the MyREADY Transition app compared to not using it. We want to see how youth will use the app as they are getting ready to transition from pediatric to adult care. And we want to see if the app will help youth to start develop skills so they become better managers of their own health. For example, knowing about their health, knowing what questions to ask, and knowing when to ask for help. The target of our RCT is 264 youth participants in the full study. That means recruitment of 66 youth between the ages of 15 and 17 years of age, along with the parent caregivers from each participating region. Throughout the stages of the project, we have always used an iterative process, for example, partnering with patients and families as we co-developed the app. We have taken a fluid, flexible, integrative, and inclusive approach throughout. We began with this adaptable model, which makes it easy to pivot when unexpected things like a pandemic arise. We embrace the idea of transition, and at every stage of the endpoint is different from what we first imagined. Some of the strategies we will share today are things that we were planning before the pandemic, and some were adopted in response to the pandemic. Some became more important in the face of the pandemic. Regardless of how they came about, we wanted to share this collection of ideas that we think may be relevant to others who are conducting research during a pandemic. So now we go to the first part that I will co-present with Donna Thompson. Donna, do you want to get your camera on and unmute yourself? I'm very excited to co-present. Thank you, Donna. Welcome. I'm very excited to co-present this part with you on social media recruitment. We have a PFAC, a Patient Family Advisory Committee, and you're part of it to develop and implement a social media strategy as a complement to our traditional recruitment. And before we get into talk about that and show some examples, I would like to ask you a question. Because as you are a parent for a couple of years now, how can you talk a little bit how social media and your role as a parent can make the trial a success? And what are the expectations of PFAC members of a trial? And maybe you can speak a little bit also about, have your expectations of your role on the PFAC changed because of the COVID pandemic?
Well, these are really, really interesting questions. I think when we began as a PFAC and all the members, the youth members, the parent members, all had some experience of transition in their either personally or in their family. And many of us had a negative experience of transition. And we were really motivated to try to contribute to this project in order to make that transition journey easier for other people going through it in the future. So, I think that we all expected to have a role in reviewing the content of the app. We expected to have a role in recruitment and in dissemination to the family communities and youth communities at the end of the project. But when the pandemic hit, I think we all experienced a sudden surge of this feeling of urgency that we better really get to work with a social media strategy for recruitment, for starters. That really involved us because, of course, recruiting through the clinics was going to be so much more difficult. So we realized that we had a much bigger role to play than we had originally thought.
Mm-hmm, for sure. Thank you.
So, I have a question for you, Jan Willem. Now with COVID, it seems even more important to plan trials that we would say are COVID or pandemic proof. What did we do on reflection to go beyond traditional recruitment strategies?
Thank you, Donna. And maybe I can have the next slide, because I have to be honest, as a researcher, I really think that we are talking about something that was out of my comfort zone. So here you see my comfort zone, and there you see where the magic happens. And I truly believed in it when it came up through the PFAC, talking about we have to go beyond our traditional recruitment strategies. We really had to work together and find out how to go about it. And we're still figuring it out as we go along. And then, of course, the pandemic even made it more, as you said, Donna, more urgent to go this way, because regular clinics were not happening, right? And still, it's a challenge to see patients in clinics. Sometimes we have online meetings. So maybe I can move to the next slide and show you that in addition to our traditional strategies of point of contact through the clinician and the community organization, we felt we should add in our study flow a social media strategy. And that would require, of course, recruitment materials and also a process to permission to contact, and then finally, hopefully, we would have youth to end up and enroll in our study and participate. And something that I also learned from the conversations and starting beyond thinking of, okay, if we say social media recruitment, what are the ways to recruit for populations, and thinking of people who have the expertise basically and the experience to do so. How do we find youth through those contacts, and which platforms should we use in addition, maybe to Facebook, Instagram, but also thinking of Snapchat, maybe in the future TikTok, and all sort of platforms we are exploring. And here you see also on this slide that we started partnering with the PFAC and Kayak, the Youth Advisory Committee. And now we're working with the parent media consultant, Croy Media, to help us really not only get the message out, and we'll show you some examples, but also to track how that would really sort of help us in study recruitment. So, because we want to learn from it as well, right? So here you see an example of a pinned tweet and basically a very colorful, nice, short and brief, but very impactful or effective way of a Twitter post to recruit. So not a full length information on the study, but really helping youth or to see if we can find youth and their families to get interest in this study and to learn more about it. Another way of recruitment is our website, and maybe Donna, you want to speak to that too, because in the PFAC it came up that we may want to have testimonials, and I can see you're one of the testimonials. Do you want to speak a little bit about that?
Yeah, it's interesting because the slide that you showed before, the poster for our project, last night I saw that on that Qua Media had posted it to multiple parent groups, and I went on each of those and said, I am a parent partner on this project. personal message me if you have any questions. It's a great project. So I think these testimonials that are personal in the disability community at large give a lot of validity to this project. We are endorsing it. And so I think these testimonies are very, very important for people to say, hey, yeah, I'm going to step up for this project because I can see that it's important to other people who are like me.
Mm-hmm. Yeah, and as we are developing those materials and strategies, we plan to post them on the Child Right website. And here you see the web page on our study website, a screenshot. And we also planned for future launches in other sites and regions. So I showed you the one from Ontario, but we plan also in the other regions to have a region-specific posting and media strategy. Can we have the next slide? Yeah. So we're back to the pandemic because that's what that's sort of the webinar is about.
That's right. This pandemic has been a very interesting experience because I think it's put a lot of people, all of us, out of our comfort zone. But Jan Willem, I have a question for you, and that is, PFAC members, parents and youth want to know how our contribution has influenced or contributed to the project. And I'm wondering if you could tell us today something about how you know the effects of social media on recruitment. How do you know what they are? Have they made a difference?
They certainly have made a difference. And I can tell you, Donna, we started our trial in July, basically. And we have as many participants recruited through the social media as we have now in our sort of traditional way in clinic. And mind you, we have just started. And things are always slow in the beginning of an RCT. But we have seen, even after the post yesterday, the post has resulted in a youth contacting us, a family contacting us with an interest in the study. So mind you, it's within 24 hours after that post, and I'm glad to hear that you chimed in as well. People are interested in seeking out opportunities. And I think also particularly during the pandemic, maybe there is something we can offer and there's something to do for youth, because some of them might be at home now and maybe a bit disconnected removed from their friends and social contact. So this might be a way of interest. I mentioned in the earlier slide that our social media consultant, Kathleen O'Grady, is really tracking all the postings and the reach of that. So that is very helpful. And we document every detail because we want to learn from this strategy and want to share that with others as well. Mm-hmm. And what do you think made it happen that our project could pivot away from the traditional recruitment strategies during this COVID-19 era?
Well, I think we were just really lucky that many aspects, of this study were online, and that all of our PFAC meetings and everything are all via Zoom and so forth. So I think, it's interesting. By nature, people with disabilities are suddenly able to engage more, knowing that the rest of the world are not off having face-to-face meetings where they can't access it. So This was always designed on a digital platform that was easy to engage people with disabilities and their families by extension. So I think, in a sense, we got off to a running start. But I also think that this subject of transition is so important to us because we call it falling off the cliff at age 18. And we want to do everything we can to make it easier for youth and families. So I think we were very motivated to pivot to what works and be creative and fearless about it.
I like that. we're fearless, for sure.
Yeah.
I want to thank you, Donna, for this conversation. And I want to turn it over to our next part of the presentation, to Barb and Alicia, to talk about online training and support materials.
Hello.
I forgot the camera. Sorry about that. So thank you, Jan-Willem and Donna. Actually, I've never used social media as much as I'm using it lately. So, Barb, I'm happy to present with you. Can you talk about how we have had to pivot for the pandemic in terms of the online training for the research assistants and the technical support for the study participants?
Sure. A little bit of pop culture there for everyone, if you could flip to the next one. So I think Jan-Willem and Donna already alluded to it earlier, that there were in fact some things that we were already doing that made it easier to pivot to the pandemic situation. So I think in these particular areas, I would say maybe we were a little ahead of the game. First, since in this study we're testing a piece of technology, it's an app intervention, there was a natural progression to just take other things online as well. Recruitment, for example, as Jan-Willem and Donna have talked about, as well as these training and support materials. Secondly, I think some of the resources we developed in partnership with PFAC to improve participants' overall experience just also lend themselves very well to the pandemic situation. So it really did give us a leg up on some of the strategies that we're highlighting here today. I think the goal in both cases was really to set everyone up for success, whether it was the RAs conducting the study visits or the study participant using the app. We wanted to have them as prepared and well informed as possible, and we wanted to bring the information to them in engaging ways in multiple formats, since we know different people absorb information in different ways and at their own pace. I think the e-learning modules for research staff are just a prime example of that.
Now, can you explain to everyone what we mean by e-learning modules for research staff?
Sure, we can just go to the next slide. I can give a bit of an overview. So it's a form of training delivered online using video modules interspersed with quiz questions to test for knowledge. In terms of background and protocols, that included learning modules like introduction and summary, family engagement, RA responsibilities and confidentiality, and study assessment procedures. For the pre-baseline process, there were modules like screening interview, consent, assent, and preparing for the study visit. For study visit process, modules like study measures, randomization, concluding the baseline visit, and follow-up visit. For intervention facilitation, there's a focused module on the MyREADY Transition BBD app. And then the training closes with modules like information and resources and contact information to just really make sure that RAs are linked into ongoing support. If you want to go to the next slide. This is an example from one of the modules, and they're all set up in REDCap with this common structure. So RAs start by watching a training video. Next slide. And then they move to a series of quiz questions that are in different question styles, such as check all that apply, multiple choice, or true false. And they are given up to 3 attempts for each quiz. And if they don't score 100% by their 3rd attempt, then they're asked to email us for a further review. And along with these e-learning modules, there are other supplementary files and resources that we've shared in a REDCap file repository, which we ask them to become familiar with as well. And next slide. At the end of each module, we have included a progress bar so RAs can gauge how far along they are in the training. So to recap, we asked them to block a few days or a full day to complete all parts of this initial training and testing online. Then we asked them to get familiar with the resources in the file repository, and then finally to do a debrief and a mock visit with us for practice. So that's just
Thanks for that quick review. Sorry. Thanks for that summary. It looks like a lot of work has gone into making sure everyone understands the procedures, they feel ready to start and comfortable to reach out to us for questions as questions arise. So the question now is, what was the feedback from the staff who have done the study training in this way already?
Okay, if you could go to the next slide. We did ask RAs to comment about the value of this approach during a pandemic and beyond, and what they liked or didn't like, and how it compared to other training experiences that they might have had. So what we learned was that they found it interactive and engaging, very effective. Next slide. We also heard it has benefits for use beyond the pandemic, as it allows people to complete the training on their own time and provides the option to revisit the information afterwards. Next slide. And that they appreciated the chance to practice the visits online and in the same platform that they would be conducting them with participants, so that being REDCap. And then there's another comment there. The only thing I feel I missed out on is connecting with the rest of the team, such as other RAs, and building that network. So I think overall quite positive experiences, and we feel that the RAs in the study are indeed set up for success going through this process. And we'll definitely consider how we could help build that RA network in other ways moving forward, since that's something they've identified. So I think now let's shift and hear a little more about setting up the youth for success when they're using the app intervention in the study. Alicia, can you talk about the support materials that we've developed for youth?
Yes, next slide. Thank you. So a technical support website is intended to respond to IT inquiries and incidences of the users. In our case, those would be the participants randomized to the intervention group, the ones that they are using the app. So based on experience, we first designed the standard sections of the website. But we understood that we have people that have different ways of learning and reaching out for help. The influence of the new technologies and social media had changed significantly over the last few years, which opened it up more possibilities for us. So our team explored the options and found that we could keep a traditional approach, including a telephone line, or we could go as far as incorporating chatbot technologies that could have a conversation with the user to respond to queries. That was something we wanted to try, but we saw that artificial intelligence was adding an extra layer of complexity that we couldn't afford yet. Finally, the questions narrowed down to two. How do youth solve issues? So do they text? Do they call? Do they ask a friend? Do they watch YouTube videos? And second, what can we afford to do that fits on the project baseline? So scope, time, and budget. And we realized that we had most of what we needed already and introduced just two new sections in the website, the FAQs and the how-to videos. This way we could respond to those users who were more prompt to do it yourself.
So what do youth see when they land on the website?
Thank you. Next slide, please. Okay, so the landing page introduces what is the app about, who can use it, and how do the user gets started. So providing all information on the app felt insufficient to us, and we saw that there were two main types of questions that they could be posted to us. So IT questions and research questions. We thought that there was a need and an opportunity for us to direct the different type of questions and to make sure that everyone was finding what they needed. From the tabs on the top of the page, we open up to technical support and download the app, frequently asked questions that are also available inside of the app, and the how-to video tutorials. We try to keep it simple and inclusive, so making it bilingual in English and French was very, very important.
Mm-hmm. So now thinking of the RAs, how would they help youth to use this website?
Yeah, thank you. Yeah, actually they use it. So during the orientation call, once the participant is randomized to the intervention group, the RAs introduce them to the support sections. Then they use the section you are seeing right now in the screen to download the app, either for Android or iOS. Then they watch together an introduction video to the app, and they complete the first visit called Introduction to Transition together. So basically, they play the first session of the app at the same time. Sorry, next slide. Yeah. So then the RI also shows the frequently asked questions on the how-to video. So they are exploring the website where the users can learn the basics of the app and its functionalities in a form of quick tutorials, how to use the bulletin board or to save your password. The videos are conceptual. They last about 30 seconds and have subtitles on following the same rules of the videos that are part of the app already. Our team has a process by which we will be incorporating more content for these two sections based on the incidents and requests that we get along the study.
So that's great. I can see how these sections would be really useful for youth who have that do-it-yourself approach and who prefer to solve issues by themselves. But can you tell us a bit more then what happens when they can't solve a problem on their own? Yeah,
so in the next slide, you will see that we have the section of the technical support. So if they don't get the answer to their questions from the support materials on the website, they can submit their specific question to the support team for a one-to-one support. On the website, we have instructions in plain language and how to get technical support. So the 3 steps to follow are shown graphically on the left, so that it's send us an email, fill up the form, and wait for our technical assistant to contact you. The form collects information on the user's device and best way to contact the user, so preferred time, for instance, phone or email. And on the right, there are hints about what information they will have to provide so they can be prepared for the call. Now, I don't know if there would be more things to discuss. Well, actually they are. But now I will turn it over to Nadaline and Sonia to talk about verbal consent and assent process.
Thank you, Barb and Alicia. And so I'm going to start by sharing a little bit about an idea that we had to create an assent video. So together with our study partners, including our Patient and Family Advisory Council, we came up with an idea that we would create an assent video. So this video would be aimed at the youth who are approached and interested to take part in our study. And we originally saw how this video could serve as a complement to that traditional way of sharing participation details in study information and consent forms. We recognize that a video format could appeal and benefit to those youth who communicate and learn in different ways. So for example, those who are visual learners might enjoy learning in this way. And you can see in the screenshots on this slide that I've taken from the video. And for the sake of time, we didn't have an opportunity to show the whole video. But you can see these screenshots and that it goes over the same type of information that you'd find in a typical hard copy consent or assent form, including information, for example, like why is this study being done, how many people will be in the study, and how long will the study take, with helpful infographics and images for aiding comprehension. So what we didn't realize at the time was that this assent video actually would make sharing about the study more easily accessible during the pandemic because we were doing virtual interviews or meetings. So our RAs are doing much of their connecting with families in that way, where they can have the opportunity to screen share and then watch this video together. So I'm going to now pass it over to Nadaline. And Nadaline, maybe you could walk us through that visit and how you actually go about obtaining consent and assent.
Definitely. Thank you, Sonia. So after viewing this assent video, myself or any RA that's working on the study will complete the verbal consent form and assent form within REDCap with the parent and youth. So this instrument summarizes the information viewed within the video, and we just ask the parent and the youth if they have any questions after each section. So we'll go through each section that is outlined in the video, and we'll just double check that they don't have any questions. If they do, we answer them and ensure that all questions are answered before moving on to the next section. And then at the end, we clearly ask them, do you give consent or assent to be in the study? They say yes, they do, or no, they don't. We capture their response, we date it, and we also indicate who is completing this verbal assent consent with them, and then that's saved within REDCap. So the next slide. Here, this is a snapshot of the verbal assent instrument within REDCap. So you will see here that we ask if there's any questions after each section. And then once those questions are answered, if there are any, we select no or yes, depending, and make sure that all are answered before moving on to the next section. And next slide. So here is the end of the instrument where the parent, caregiver, and youth are asked if they give consent assent to be in the study, and we capture their response here.
Great. Thanks, Nataline, for going over that process with us. So most of my expertise has been in the area of qualitative research, and I'm even thinking of some survey research where perhaps we've been given permission from REBs to obtain verbal consent or maybe electronic sort of implied consent. But I'm curious, before the pandemic, had you ever used anything like a verbal consent process such as this in any sort of quantitative study or randomized controlled trial?
So my experience with this was no. Before the pandemic, we were only given permission to do written consent. And if we were doing a mailed questionnaire package, we would have to receive that written consent back from them. COVID has managed in a very short time to accomplish approval for these processes when there was a lot of pushback pre-pandemic. So things like virtual health appointments and now verbal consent assent as an alternative to written consent. This was a lot harder to get approved by REB previously, but we have now been approved given the circumstances.
Thanks, Nataline. And I wonder if you think that might be part of sort of the new normal moving forward.
I don't know. We'll have to wait and see.
Thanks.
Thank
we'll
you.
pass it over now.
Thanks, Nataline and Sonia. And so we'll move on now into our section about how to conduct the study visits online virtually. So due to COVID-19, all study visits are conducted via Zoom, and this allows us to enable different security features to ensure confidentiality and privacy. So here's a screenshot about how we schedule the Zoom meeting. So we include features such as a meeting ID, a meeting password, having the video on, so that provides the option for either the RA or the participant to have the video on if they choose to. And we provide options for the audio to either be calling in by telephone or using a computer audio. We also include the features of muting participants when they first enter into the room, and we enable the waiting room. A waiting room prevents uninvited guests from joining the meeting because the RA will have to approve for the participant to enter into the meeting. Another important aspect of conducting online virtual study visits is developing rapport with youth participants. So now I will share a video of a recording with Claire Dahl McCord about her perspectives.
Just bear with us a second till we get this launched. Are you having difficulty with the video?
Yep, so I do have a backup as a YouTube video, so I will just have that on instead.
So hi, Claire.
Perfect.
Great.
Thanks for joining us today. So we want to hear about your perspective about how to develop rapport with youth participants during online study visits. So I had a few questions to start off with our discussion, if that's okay with you.
Mm-hmm.
So my first question is to ask around that, knowing that the study visits are conducted online virtually now due to COVID-19, what are your suggestions about how to schedule the online study visits with youth participants?
Yeah, so as a young person with a lot of complex health issues, I think I know better than anybody how chaotic teen schedules can be. And I believe like if you want to have truly engaged participants, you're going to have to work around their schedules. And that may mean that you have to meet with them on weekends or in the evenings. And it's also important to note that depending on the age of your participants, email might not be the best way to reach them. So you may need to be flexible in terms of the best way to contact them as well.
And that's actually so important. And it's great that you brought that up, because in this study, we also adopt a flexible approach where we ask youth participants about different ways that we can even contact them, whether it's by email or even sending text messages to them so that we can schedule the online visit. We also have this individualized approach where we recognize that youth participants may have different schedules. So we even ask whether what's the best time that we can contact them and to schedule that online study visit, whether it's different times of the day, even offering evening times as well as the weekend. So overall, we adopt this flexible and individualized approach to schedule our online study visit.
That's great to hear.
Yeah. And after we schedule the online study visit, what would be your suggestion about how to introduce the study in the online visit with youth participants?
Yeah, so building rapport with young people can be difficult enough as is, nonetheless trying to do it virtually. And one thing that's really important to me as a research participant to understand is that my time isn't being wasted. And if I participate in a study, I want to know what the study is about, what they're going to be doing with the interviews, what's going to take place during the interview, how long it's going to take, and how the results of the study can either help me or others. It's also really important to stick to a timeline. If you think your meeting might run a little bit over time, book it for more time. And if it's really difficult to get everything done all at once, maybe even booking 2 meetings to make sure that you're not messing up the schedule of the person you're interviewing.
I know that during one of our patient and family advisory council that you're a part of, we had a meeting where we discussed around what are some ways that we can stick to the allocated time. So one way is that we created this visual roadmap, which I'll share my screen now to show how that looks like. So this is the visual roadmap that we created that all the RAs will show to youth participants at the beginning of the study visit to outline the information that we'll be going through together with youth participants. So we outline the steps of the study visit. That includes at the beginning asking for consent from youth participants, followed by questionnaires that we'll be asking them to complete. Then there will be the randomization process that will take place, where youth participants will either be randomized to the control group or the intervention group. If they are placed in the intervention group, the RAs will then provide information about how to download the app and information to orientate them to how to use the app. And then we'll wrap up the study visit with a thank you. So that includes providing the e-gift card as a token of our appreciation for their participation in the study, as well as the reference handouts. And so overall, we thought that this visual roadmap is something that can be helpful to share with youth participants, just like how we're doing now with sharing our screen, to show to youth participants the information that we'll be going through with them in the study visit. And in addition to that, once the study visit is taking place online, in terms of responding to questions from youth or even recognizing the verbal cues or even nonverbal cues from youth, what would be your suggestions to RAs around how to respond to that?
Yeah, as someone who is a science student and has participated in a number of research projects, I know how easy it is to get kind of caught up in your own head for your personal objectives for the project. And what you think might be best for the group or the subject that you're speaking to might not always be the best thing for them. And I believe that in both the design and the proceedings of your study, you should try and get the voice of the youth, if you are working with a youth population, to be heard early on, to make sure that this is a project that is important to youth. And the best way to do that is to just go to the source. So if you're working with young people, talk to young people. There are a number of programs, such as the Child Bright National Youth Advisory Panel, that have consultation services which can better the research process for your participants, and they're run by youth who have experience being in research projects. And if you aren't able to use a youth consultation service like that, you can just try putting yourself in their shoes. All of you were teenagers at one point, and just try to remember what that felt like. So there's a good chance that, you know, the adolescent participants in your study might be in it for the gift card, and that's okay. Just realize that maybe the nitty-gritty details of like how you're going to do the proceedings of the research might not be the most interesting part to them. And try to frame the project so that they know that what they're doing is important and that it can make a big impact in the future. And then I think in terms of encouraging video participation, I'm sure everybody recently has had felt the pressure to turn on their camera if the person you're meeting with has theirs on. So I think it's important that as the RA, you start the meeting with your video on. Of course, you can make it clear to the person that you're interviewing that, you know, if they're not comfortable having their camera on, that's perfectly fine. But I think that, you know, there's a certain level of communication that you don't necessarily receive without somebody's video on. So encouraging that is important.
Mm-hmm. And with that, in terms of having the video, we also provide youth with an option. So we ask them when booking the study visit if they would like to have the study visit by telephone or by Zoom. If it's by Zoom, then we can have the option in a way that we can see each other by turning on the webcam, just like both of us right now. And it's great that you brought up around that consultation with youth. So even early on in the process of us creating the recruitment videos and the recruitment materials, such as posters, we also ask for feedback from youth, not only through our Patient and Family Advisory Council or PFAC, who have partnered with us throughout the project, but also by consulting the Child and Youth Advisory Council or KAYAK from Alberta Health Services. So that was a way that we can ask for feedback and consult with youth to ask from their perspective, how would they feel or see themselves being engaged in our studies. And so as a final question to wrap up our discussion, I wanted to ask you, what kind of information would be most important or helpful for youth before leaving the study visit? So for example, in our study, to wrap up the study visit, we asked youth about the e-gift card, so to a store of their choice, and we provide different options, as well as the reference handouts that we provide to them that they can take with them and refer to while they're either using the app or continuing along and preparing for transition from pediatric to adult healthcare. So from your perspective, what other kind of information would be most helpful to youth?
For me personally, I always want to know how the study turns out. So I think it's important that you offer to send your participants progress updates or even just a shortened blurb in plain language about your findings once the research study is published.
And that's great that you brought that up as well, because that's something that our research team is also thinking about in terms of sharing summaries of preliminary findings or progress updates, as you mentioned, in different ways, and asking youth and families if they would like to have those updates. And we will also want to share with youth participants that if this study and trial shows that there are positive benefits to using the app, we would like to offer all youth participants a chance to use the app for a limited time after the study has been completed. So that's something that's in the works and something that we're thinking about how to do that. So thanks for bringing that up.
Thank you.
Great. And thanks so much for sharing your perspectives today.
So Linda, we're going back to the slide deck. Yeah, thank you. So I will use the last minute to wrap up. So just to briefly review what we've done today in this webinar, we co-presented with the youth and parent participants on our study with the study team. I gave you a little bit of background on transition to adulthood and the process for youth with brain-based disabilities. Then Donna and I had a great conversation about social media recruitment during the pandemic. Barb and Alicia talked about online training and support materials that have been developed in our trial. Natalie and Sonia talked about the consent and assent processes, doing that online. And lastly, Claire and Linda gave you an insight in how to conduct study visits virtually and what's important to youth. So here are our summary messages. I think we, together with our experiences, feel that a flexible and iterative approach can be helpful to conduct research, especially during a pandemic. And we hope it has been helpful for you to hear about a unique set of strategies to address obstacles, especially doing a RCT online in different regions and different places. And we also believe that it's important to share and discuss strategies across all projects being conducted during this pandemic, as we all learn together. So we have 10 minutes left, and we welcome discussions and questions. And I'll turn it over to you, Paula. And here is our QR code if you want to learn more about our project. Thank you so much. Paula, over to you.
Thank you all. We do have a number of questions. I'll start, though, with some of the comments that are coming through. Thank you so much for an insightful presentation. Great ideas around online training and virtual study visits. One of our international colleagues has said they are getting ready to start their first online research, and great to learn from your experience. So with that, I will start with the first question. Brianne asks, what was the cost of online recruitment? And she notes that most of the investigator-initiated studies at her institution have limited funds to start with. And then secondary to that is, how did you secure the funding?
Right. I think I will start off, and then maybe others on the team can chime in. I think we have been lucky because this project was funded as part of a larger child-right patient-oriented research program, which is a 5-year funded program and also allows for some extra time as an extension to complete the trial. So that was basically helped us to sort of for the larger projects to absorb those costs in that way. And I think it was also a way of being to pivot our strategies that we are sort of working on and planning already, but now, as Donna said, had the urgency to pivot it. So maybe I can turn it over to Barb. Do you want to chime in on this question?
Yeah, another thought that I had was that we were sort of able to reallocate some resources. For instance, we had initially planned to purchase some tablets for RAs to have when they were meeting with youth in person, just to make sure that they had something to demonstrate the app on if the youth didn't have the technology with them. So I think there we were able, since we weren't doing that anymore, we were able to take those funds and move it elsewhere. And I think actually the next question ties a little bit to social media recruitment as well, and sort of how, so the cost and how we know sort of where it's working and where it's not working. So I think I would really plug working with a consultant who has has experience doing this type of thing, has connections. And Donna maybe can speak a bit more to that, but I think whatever cost it is, and I can tell you it isn't a huge cost for the benefit, I think. And it's done in waves, so that the question about, it's sort of waning over time and not being interested, I think that's part of the strategy to keep sharing and keeping it. And maybe Donna, you can speak to that since you're so good at that.
Yeah, well, I think that, yes, I amplify everything that you just said. The consultant with expertise in this particular area working, on social media and research, that's like the secret sauce here. And I think it's important also to think very intentionally and strategically about the assets in the project and how can you use the consulting role in partnership with the PFAC and everybody else on the project in order to amplify those messages and give testimonials and so forth. So all of this is not accidental. It's all very intentional.
Mm-hmm.
And I think it's important that we do it in waves to keep the momentum and constantly try to reach new audiences online as well.
Mm-hmm.
The next question is from Daniel, who is a clinical research coordinator for an RCT drug trial taking place in Toronto. The team has advertised through social media pages where families with children diagnosed with cerebral palsy typically interact. They had a good amount of responses at first, but the interest has subsided over time. And as the pandemic has progressed, are there any specific social media pages or platforms where you have had success engaging with brain-based disability community members, specifically parents of children with those disabilities?
Can I tackle this to start with?
Yes, please, Donna. Yeah, go ahead.
So I think one of the things that we did wrong at first was that we sent the same message out. And then when we got Kathleen on board, our consultant, she said, you have to change your message every time. You need to do novel messages in order to keep in order to not create a sense of boredom and repetition about your study. That'd be like the kiss of death. So don't want to do that. And you want to create novel messages every time. So I think there are, the other thing that we did was we created in our PFAC map of every member's networks. Every member of the Parent and Youth Advisory have what's your Twitter handle, who do you know, so, and what groups are you members of, and can you bring the constant flow of new messaging to those contacts and to those groups. And we coordinated that, I think, quite effectively on this project.
Mm-hmm. And may I chime in here, Donna? You also brought up a very good point that if you do social media recruitment, you may get people responding that may not be eligible to the criteria of a study, and you have to think that through, because that's also a risk, right? To bring people to you and then maybe not to actually end up in the study. Can you speak a little bit about that as a parent? and
yeah, it's very emotional, and people get very upset when, particularly I think because we know that one of the strategies that's highly effective is to ask the public for help. And if you do that, we need your help is the tagline of the current lot of messages that have gone out recently on social media for this project. And if you come back to somebody who's stepped forward and you say, no, we don't want your help. You're not worthy is what they hear and experience. And people are often quite upset about that. So I think the more personal responsiveness that you can offer to the general public when people do make inquiries, to be very explicit about exclusion, who's in, who's out of this study. It's the personal connection, I think, that can lay the groundwork to create allies for your next project if they're not eligible for this one.
Yeah, and maybe to add to that and turn it over to Linda, because she has helped also to develop resources that we say, well, you may not be eligible for this study, but we have some resources that may be helpful for you, or maybe we can follow up with you if there are future studies. Linda, do you want to?
Sure. So we work with the Patient and Family Advisory Council. And so we worked with them to create a handout about the criteria or explanation about the reasons for how come a potential participant may not be eligible. And then, but there was more than that, because what we heard from our PFAC members is that about having that personal relationship where the RAs can talk to the families who aren't eligible and ask their reasons or what might be of interest to them. So we're directing them to other resources, and specific to this project, I would include transition resources, maybe other apps that are available, or even other research studies that are recruiting right now. So that's where we're thinking about how RAs can form these relationships and connect with the families more than just handing out a flyer, but then asking if they would like a handout with more explanation.
Mm-hmm. Paula, I think we need to go back to you for time purposes, right? Sorry.
We're almost to the end of time, and we have one additional question in the question box. Have you noticed any differences in attendance to scheduled meetings online versus in person, and any strategies to support compliance or adherence in a virtual environment? Do you send appointment reminders, for example?
Natalie, do you want to?
So yes, I do send reminders before our call and with the Zoom link if that's the option that they have chosen. Now, I think it is a little bit easier to reschedule in these times versus an in-person. So have I had patients reschedule on me in a short time frame? Yes, but it always happens quickly, and it seems to be easier for me too. So I do feel that that's happening, but not to a detriment to the study or not being able to get these visits done. It's always just a quick change, like, oh, can we push it back an hour, or tomorrow instead of today? And I think there's so much going on in the lives of youth too. So when it's a call with just the parent, it's really easy to keep it on schedule. With the youth, we also have to adjust that their work schedules change or their school life changes and things. So we do have to be flexible in that sense too. And like it was stated before, we have to accommodate to their schedules, and they really do appreciate that. And I think in this time where we're not having to physically go to a location to meet them, it's much easier to just adjust the time of the Zoom call. So hopefully that helped.
It does. Thank you. We've come to our end of our time today, so I want to thank you all, Jan Willem for moderating, and for the rest of the panel for sharing their time and expertise with us today. Thank you also to all our members and other attendees for spending this time with us. We hope you depart with some practical knowledge to bring back to your organization. We are coming to the end of a packed fall live webinar season. Pardon me. Join us next week on December 2nd at 11 a.m. Eastern for A Path to Equity, How Care Coordination is Helping Children with Medical Complexity and Social Challenges. We're now looking for content to complete our winter Spark Live webinar season. If you have an innovation or improvement story to share, or are ready to spread and scale, please contact us at spark@childhealthcan.ca. It's always great if you can watch live, as your questions and comments really enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our Knowledge Exchange Network. So thanks for joining us today. Thanks to all our guest speakers for this presentation, and to ChildRight for supporting our webinar program. And hopefully we'll see many of you back here next week. Bye, everyone.